In a normal year, we'd be talking about the growing number of flu cases around the country.
Yeah, that's right. Take a look at this map from the CDC. This is what the country looked like week 2, 2020. As you see, a lot of red there. That's influenza. And we'll see what it looks like now. I think numbers are a little bit better.
I mean, take a look at that.
Yeah,
This is
now,
week, week 2 for this year, and you see all the green there. That's because officials say flu activity is unusually low right now. And this morning, we're asking the question why.
Yeah, let's bring in our chief medical correspondent, Dr. John Torres. Dr. Torres, good morning.
Good morning. So how do you explain this? I mean, is it because we're finally not so germy? We're washing our hands and wearing masks and being more careful?
And Savannah, I never thought in my career that I'd see a flu season this low, where I'm talking to friends across the country, and they're saying the same thing. We're just not seeing the flu. And it's because of the things we're doing for the pandemic, the washing our hands, the social distancing, the wearing masks, the staying home. Those are important steps that public health officials for years have been saying we need to do to keep the flu under control. Well, we're doing it this year to keep coronavirus under control. It's helping with the flu. And of course, the shot. Record numbers of shots were manufactured this year. Almost 200 million people got their flu vaccine, which in a given year, we wish we could get that many people to get it. And so hopefully going forward, they keep doing the same thing and keep doing these practices year after year.
Well, Dr. Torres, a lot of kids are not in school because of this pandemic. And we have a question, actually, from Wendy in Montana about that in virtual learning. Take a listen.
Has keeping our kids home from school helped to keep the numbers down?
Seems like kids not being in school means fewer germs, I guess.
And Hoda, it does help keep the numbers down because we know in a given flu season, kids are a big driver of the high numbers of cases we get, and they tend to spread them from school to homes. And so them being at home certainly helps. But all of us are at home right now, and so we're not going out there meeting other people. We're not spreading flu like we normally do. And if you think about it, you know, the subways, the buses, even our offices, nobody's really around. And so you don't have that ability to spread it, which is why that's happening this year. And of course, doing these measures we do go a long way towards keeping that and coronavirus under control, Hoda.
Dr. Torres, this next question is about what this could portend for next year. This is Deb, and this one's from Facebook. Take a listen.
With the record low number of people who got the flu this year, does that mean the flu will be stronger next season?
Dr. John?
You know, these are great questions, and flu is very quirky, and flu does what flu is going to do year to year, so we have no way to predict what's going to happen next year, and it could be a very strong year, it could be a year similar to this one, and that's why we always tell people in the fall to get your flu shot. And the thing you have to remember, too, is we're not through the flu season yet, so it is possible that we could start seeing more cases. So if you haven't gotten your flu shot, you need to get it now because, again, it could still be cropping up over the next couple of months.
Dr. Torres, it's Carson. Big fan of yours, by the way, on Nightly News Kids Edition with Lester Holt. You do great work. Let me ask you about this spring, as some of us might be eligible for the COVID vaccine. That might coincide with when we would normally get a flu shot. How do those two vaccines relate to one another?
So there are two different vaccines, Carson, and you want to make sure that you get the COVID vaccine, obviously, to protect you from COVID, but that doesn't protect you from the flu and vice versa. Now, you want to space those out by a couple weeks if you are getting the vaccines, and so make sure you do that, but also realize that getting one doesn't protect you from the other one. However, it'll keep you healthy, so if you do happen to get the flu or you do happen to get COVID and you've had both vaccines, then you can go ahead and make sure that you're not getting the other one, an important step to keep you healthy.
Yeah, Dr. John. In fact, my doctor told me I got to wait 2 weeks. I'm getting my second dose February 9th, and then I got to wait 2 weeks after that to get the flu shot. But you know, when we got the coronavirus, we got flu season, you get a stuffy nose, you may be sneezing. How do you tell the difference between the two?
And Al, not to brag, I'm getting my second shot February 8th. So
Oh, yeah. Oh, very good. Oh, all right. Special.
But the main thing is, you know, the two have similar symptoms. You get that stuffy nose, you get the body aches, you get the shortness of breath. Big difference is it comes on very fast for the flu, and for coronavirus, it doesn't come on quite as fast. And with coronavirus, there's that one distinctive symptom, the loss of sense of smell or taste that differentiates the two. If you start getting them, think about getting a test. If you get a COVID test and it's negative, but you're having symptoms, ask about getting a flu test as well, just to make sure you don't have that, because it could be that either one.
All right, Dr. John, thanks
Well, not
so
to
much.
brag, Dr. John and Al, but the rest of us are too young for the shot.
Oh,
hey.
Ouch.
Ah, there you go.
That's going to leave a mark.
Yeah.
Dr.
You win
John,
that one.
thank you very much.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.